Hey everyone, and welcome. If you're a nursing student, you're in the right place. Today, we're getting into a topic that's becoming absolutely essential in modern patient care: complementary and integrative health. We're going to talk about what you can do for your patient when medication just isn't the whole answer. So let's just jump right into a real-world scenario, one you are guaranteed to face on the floor. Imagine this: your patient is in pain, they're getting agitated, and you look at the clock. Their next dose of pain meds isn't due for another hour. So what do? What tools do you have besides what's in the medication cart? This is exactly why we need to talk about this. Okay, so to answer that question, we need to expand that toolkit. And to do that, we got to make sure we're all speaking the same language. Let's start with the stuff you're already learning day in and day out. Right. Conventional medicine. You might also hear it called Western or allopathic medicine. This is the world of your textbooks, your clinicals, your NCLEX prep. It's the bedrock of our healthcare system, scientifically proven, evidence-based, and it uses incredibly powerful tools like meds and surgery. This is the primary framework you'll be working in. Now, this next part is so important because these words get mixed up all the time. Complementary versus alternative. They are not the same thing. The key difference is one tiny little word. Complementary therapies are used with conventional medicine. Think of using aromatherapy with a patient's pain medication. Alternative therapies are used instead of conventional medicine. Knowing that difference is absolutely crucial for patient safety. And that brings us to the big picture: integrative health. This isn't about picking a side. It's about bringing everything together: conventional, complementary, and yes, sometimes alternative approaches to treat the whole person. We're talking mind, body, and spirit. It's all about collaboration and putting the patient right at the center of their own care. So, what does this stuff actually look like? Well, the National Center for Complementary and Integrative Health breaks it down into a few categories. First up, nutritional approaches. This is a huge one for us as nurses, right? Because our patients are out there buying herbal therapies, supplements, probiotics, you name it. Our job is to be the investigator, to know what they're taking so we can watch out for any potential interactions with their prescribed meds. Next up, we've got psychological approaches. What I love about this category is that it really highlights that powerful mind-body connection we're always talking about. Things like guided meditation, deep breathing exercises, even prayer. These therapies tap into the mind's ability to influence the body and promote a state of healing. And a lot of the time, your role is to be a coach, teaching patients these skills that they can use forever. And finally, we have the physical approaches. These are the hands-on therapies: massage, chiropractic care, reflexology, but it also includes things you can do all on your own, like applying heat or cold. That's the key here. Many of these are independent nursing actions you can use to give your patient some immediate relief and comfort. So we've covered the what. Now let's get to the most important part, the so what. Why does this actually matter for you as a student and as a future nurse on the floor? Well, look at the numbers. The data is pretty clear. Over the last couple of decades, the use of these therapies has nearly doubled. This is not some fringe thing anymore. It's a mainstream part of how people approach their health. And you can bet your patients are using them, whether they mention it to you or not. And really, that's the bottom line. Knowing about complementary and integrative health isn't just a nice little extra bit of knowledge. It's part of our professional duty. It's how we build trust, have honest conversations about what our patients are doing, and make sure their care is safe, effective, and respects their personal and cultural beliefs. It's just good nursing. This entire way of thinking is perfectly captured in an idea called holistic nursing. And it's a really powerful perspective shift. You're not just there to treat a diagnosis on a chart. You are there to help heal a whole person. It recognizes that deep connection between mind, body, and spirit, and it puts that nurse-patient relationship right at the heart of everything. And this isn't some vague, fluffy concept. It's a real framework for practice. It means we're proactive about wellness, not just reactive to sickness. It means we truly honor what the patient is telling us about their own experience. We see them as a partner in their care, not just someone we do things to. Okay, theory is great, but let's be real. How does any of this actually apply when you're in the middle of a crazy 12-hour shift? Let's bring it back to the bedside and make it super practical. So let's circle all the way back to that patient we started with. The non-holistic response, it's dismissive, right? Sorry, your medicine isn't due yet. Just try watching TV. It just shuts the patient down. But the holistic response, that's where you get to be an amazing nurse. You offer your presence. You take 60 seconds to guide them in a simple deep breathing exercise. Maybe you use a bit of approved aromatherapy. These small actions can make a huge difference. And let me be perfectly clear about this. This is never, ever about replacing necessary medications or conventional treatments. It's about expanding your nursing toolkit. It's about having more skills at your disposal to promote comfort, reduce anxiety, and improve your patient's overall well-being. Now, before we wrap up, there's one more person we have to apply these principles to, and that's you. This quote says it all, doesn't it? Nursing is demanding. It's tough, and you simply cannot provide compassionate, holistic care to other people if you yourself are running on empty. Self-care is not selfish, it's a professional requirement. To really thrive on this incredible journey through nursing school and into your career, you've got to keep learning, and you have to take care of yourself. If this explainer was helpful, do me a favor and like, share, and subscribe so you don't miss our next one. And hey, if you're gearing up for that big exam, check out the links below for our NCLEX revision guides. Thanks so much for joining me. Keep up the great work, and please take care of yourself.